Hey guys, welcome to episode 4 of Health Tea with Dr. B. Thank you all for joining this afternoon, or excuse me, this evening. I'm just so confused. It's been a really long day. And so, thank you all for joining tonight for this episode of Health Tea with Dr. B. Yes. All right. So, I'm just giving some people some time to kind of log in so they can come in, get it together, because this episode is really good. You know, it's called When Normal Labs Don't Tell the Whole Story. Now, a lot of people should be able to relate to this. Okay. All right. So I'm just waiting for more people to log in. All right. Hmm. Hi there. How are you doing today? I have some people who've actually joined the stream directly. Hello, everyone. Hey. All right. So, yes, we are live on YouTube and Facebook. Okay. If you guys are on Instagram, I'm unable to go live on Instagram at the moment. However, you all can find the link in the bio. All right. Hello there. Hey, Jasmine. Hey, Tanisha. Hey, Tommy. All right. This is awesome. So as you guys can see, I upgraded a little bit. I did. I upgraded a little bit. Upgrade the background, our streaming system. Hopefully it is much clearer. Hopefully you all can hear me better. But today's episode is going to be fantastic. I could not wait to do this one. Okay. So as people are still joining in, which is fine. I'm going to recap what happened last week. I wanted to thank all of those who participated last week, or even just joined the live last week. We actually discussed hair loss. Hair loss is huge in our community. So, myself and MP Jasmine, we definitely started to discuss how we can protect our locks, how we can protect our roots, right? Because there are so many factors that's causing us to have hair loss in the first place, right? And it's so much bigger. It's so much bigger than just getting biotin or biotin injections. It's so much bigger than supplements. All right. So we discussed thyroid health, iron deficiencies, vitamin D deficiencies. It was a lot. So if you guys have not had a chance to watch hair loss, it is actually stored in Facebook with Health Tea with Dr. B. Okay. So you can always watch that video and record. All right. All right, awesome. So, of course, every week I'm always bringing in a tea. That is great. But this week I decided to kind of remix it a little bit. I am bringing back the Rooibos tea because I don't think I did much justice with this back in week 2 for week two's episode because this is really a great tea, you know? So, I'm not sure if you all can see this, but that was Fresh Pack Rooibos tea. Okay, so it's a really great tea. Rooibos tea, it is a red bush tea that is popular, and it's a popular herbal beverage that was made from the leaves of the rooibos plant that's native to South Africa. I mean, the health benefits are huge, huge, huge. I found myself drinking a lot of it today because I had a lot going on. I had a ton going on, and I just needed energy, right? So, hydration is the big one. It's a hydrating beverage, and I like to take mine hot. It's not bad when it's cold, but I love mine hot. And it is a great alternative to any sugary or caffeinated drink. So today is the first day that I have not had any caffeine. So Rebels tea came in with that. Definitely did. And so the taste isn't bad. Again, it's allergen free. So those who have allergies, you will be good to go with this. But here's my tea right here. I let it steep for about 10 minutes before consuming it. This time I didn't add any monk fruit. I felt like I didn't need to. I usually don't put any sugar in my drinks, but This is it, and this is one of my favorite cups. It is black and gold and orange, favorite colors, but this is actually one of my favorite cups to drink my tea in, and it keeps it really hot. So going back to the benefits of the rooibos tea, weight management. Okay, so today I've been really busy, but when I was drinking this tea all day, it gave me a feeling of fullness and it stopped me from overeating. So I've been good on that. It also has anti-inflammatory properties. So my people who have arthritis, this tea is good for you. It helps to aid with the management. It doesn't cure it. So remember, that's a big word. These are complementary therapies, okay? These are complementary therapies. It may help, okay? Just like it may help alleviate any stomach discomfort, indigestion, and diarrhea. All right. So much justice a few weeks ago, so I had to bring it back. And it's pretty good. So you can always find it on Amazon. I just wanted you all to know what tea that I was bringing in for the week. All right. Now let's get into our episode. When normal labs do not tell the whole story. So let's sip, listen, and thrive. All right. So, who here has felt fatigued, but their labs were normal? I'm sure all of us have. I think that we get so caught up in getting older that we accept anything and everything that comes with it. So, when I get patients in the office, they always say, well, I'm tired, but that's life. I have kids, I have bills. That's adulting. But absolutely not. Absolutely not. We're not accepting that at all. And I don't want any of you to accept any of that language or behavior because that is not normal. Um, and I have a personal story to share because I have been going through a lot of things, especially when I was younger. And I just was unaware about a lot. So back in 2015, I remember being a full time parent, working full time, in school full time with a full time business. I had an assisted living, a family owned assisted living. I was always tired. And I was much younger then, but I was always tired. I could usually fall asleep with my eyes open, and everyone used to just make fun of me because I would be literally staring at you and be asleep. So I went to this doctor at a local hospital, and he was a famous doctor, and everyone ranted and raved about him. They kept saying, oh, he is the best. You have to go to him because he will get you together. You have to go. So I went. All right. So I went, and he did the basics. I said, hey, doc, can we get like a thorough blood panel? And at the time, I wasn't even hip to a thorough blood panel. It's just that's what I was told to ask him. But he did the basics. He did a CBC, a BNP, hemoglobin A1C, and a lipid panel. He said that he knew for sure that due to my BMI, which is my body mass index, he knew for sure that I had obstructive sleep apnea. So, me being the dramatic person that I am, I got the sleep study done because now I think I'm dying. And I said, hey, oh my God, like it's the end of the world. I was young. I was like, oh my God, I can really have sleep apnea. So I went for the sleep study, and guess what? It was negative. He looked at me and he said, I guess I will check your iron and your vitamin D. I guess. And so, guess what those numbers were when they came back? My vitamin D level was 4, and my iron saturation was 6%, which is dangerously low. So no wonder I was exhausted. I didn't have the vital nutrients to keep me going. And also, I was young, so it was assumed that I was completely healthy. So, the purpose of this podcast tonight is to ensure that you all are getting what you're supposed to be getting. Yes, you may be young, but there is no reason why you should not have a thorough blood panel because what I'm seeing in my patients, whether it's in my office or any other medical office, is that people have been having issues since 18 years old, even before 18 years old. And now that they're 40 or 50, they have chronic kidney disease, they're on dialysis, they have high blood pressure, they're on tons of medications. It's just a lot that's going on. Okay. So the goal here is just to make sure that you are getting what you're supposed to be getting. So let's talk about labs. Okay. I feel like you all have been in that boat. That story that I just told, I feel like you all have been in that boat, right? Your labs were normal, but you still felt tired. You felt weird. Okay. Now, I'm sure that a lot of you did not have the chance to even discuss with your doctor about what should be done, but today I'm going to teach you that. All right. So, here are labs that mainstream medicine draws annually, which is once a year. So, it's usually a complete blood count, which is a CBC, a basic metabolic panel, which is a BMP, a lipid panel, a TSH, sometimes a free T, and sometimes hemoglobin A1C. And when I mean sometimes. Okay. I have friends and I say, well, go get your labs and go to your doctor because I really don't like treating friends because it could be sometimes a conflict of interest. But when I look at their labs, I'm always excited that they went to their doctor. But then when they come back, I'm like, well, why did they only draw a CBC, a BMP, and a lipid panel? Or and a TSH? Why? Why is why? That's not what is that? And guess what? My friends, they accept it. The other people, when I asked them, they've accepted it. They said, well, they're the doctors. They're supposed to know what I need, which is fair, right? But now it's time for us to advocate for ourselves. So here's the T. Those labs that I just mentioned earlier, that is not going to tell you anything. Okay. So when people come into my office and they start to say, hey, well, I already had my labs done, I'm good to go. The answer is absolutely not. You're not good to go because those labs will tell me absolutely nothing. Okay. So here are the labs that I draw in my office. All right. And it usually scares a lot of my people, but they love it once I explain it. I do all the above. So I get the CBC, the CMP, a lipid panel for cholesterol, hemoglobin A1C, and this is where it gets really thorough. I get a fasting insulin, iron in TIBC, a ferritin level, a vitamin D, a vitamin B12 and folate, a TSH with the free T4, a free T3, TPO and thyroglobulin antibodies that goes along with your thyroid panel. I usually get a reverse T3, but only when my patient is on levothyroxine or Synthroid. That's medication for your thyroid. I usually get a FSH and LH if one of my female patients is not on birth control and we're trying to figure out if they have PCOS. And we had a long discussion about PCOS a couple weeks ago. So everyone has PCOS unless otherwise. So I get FSH and LH if you've been off of birth control for at least a month, and a CRP level. But guess what? That's not all. If you present to me with metabolism or other hormonal issues, I do draw a testosterone level, estradiol level, progesterone, and DHEA. These are labs that sometimes people have never even heard of before. Okay. And other labs that I like to throw in there, a uric acid, that's a new one that I've been drawing in to test for inflammation, and homocysteine levels. And for my male patients, prostate specific antigen, so PSA. All right. So just thinking about what I just said, those are a lot of labs, right? Those are a lot of labs. So it's usually about 5 to 6 tubes of blood. Um, but it's so worth it. It really is worth it. Now, when you do get these blood levels drawn, okay, you can't have just anybody draw these levels because now your doctor or your provider is going to have to explain it to you. All right. So that's going to be the important part here. So if you need these labs drawn, first of all, you have to know what the purpose is, right? Know what the purpose is, why it's being drawn, and you have to make sure you have a qualified medical provider who's going to be able to understand what they've drawn and explain it to you. Because you should not leave out of the office with someone saying your labs are normal. Mm-mm, mm-mm. I don't think I've ever said normal to anybody. So here, what is normal? I'm not normal. You're not normal. So normal is a thing of the past. We want to discuss optimal. Are you optimal? How is your quality of life? How are you feeling? Okay? Because there are so many people out there who say, I feel terrible, but their labs look like they're in decent shape. All right? So now let's go into the CBC. Let's do that. Okay? And let me look around. I have a private chat here. All right. Oh, hey, Miss Arnetta. Hey, Jasmine. I have my two people who are in the comments. Hey, Jessica. Jessica actually joined the live stream right now. Hey, Jessica. How's it going? Thank you for joining. Yes, thank you all for joining. This is awesome. All right. So now let's get into it. Let's get into the CBC and what I look for. So when I do lab reviews on my patients, I color code all the ones that I'm paying attention to, that's important, and those that can be impacting your health. Okay? So when I look at the CBC, I'm usually color coding the white blood cell, which is the WBC. All right. So with that number, I'm usually, or with that particular thing, I'm checking for inflammation and infection. So I'm usually looking for a number that's less than 8.5. Okay. And now here's the thing that I want you all to keep in mind. When we're looking at these lab levels, a lot of these levels are not going to say high or low. They're just going to be, it is what it is, which means normal. So when I say I aim for a number that's less than 8.5, that means that 8.5 isn't going to highlight as high or low. It's just going to be normal. All right. So again, we're all about prevention, preventative measures. Okay. So for the white blood cell, I am looking for a number that's less than 8.5. All right. But greater than 4. Okay. And then I also look at the red blood cells, which helps to deliver oxygen to our most vital organs. Once I look at the red blood cell, I look to see the quality of the red blood cells, like how big, how small, is it pale, is it deep red? And I do this by looking at the hemoglobin, the hematocrit, the MCH and the MCV. Those are the letters that we always see, and we're like, what the heck does this mean? Okay. And why do I look at those numbers? I look at it to see if I can determine any anemias. Do you have microcytic anemia, macrocytic anemia? All right. And these are numbers or values that I'm not expecting you to know, but I'm just telling you what I'm looking at, because when we're going through our review, the goal now is for you to say, okay, wow, I understand. I trust my provider. Okay. And so honestly, if there's nothing out of place outside of that CBC and what I just named, then we're usually good to go. We're usually good to go. Now, if it's allergy season, then yes, I look at your eosinophils. If you do have an infection, I look at your leukocytes. So I look, or neutrophils, I look at those things. All right. But honestly, after that, I skip down to the complete metabolic panel. So there's two. You have a basic metabolic panel and then a complete metabolic panel. And now what am I looking at? I'm looking for your fasting glucose. Glucose is usually the top with your CMP. I'm looking for that number to be less than 85. If you haven't fasted and you ate and you forgot and you got your blood drawn, then I'm usually looking for up to 115, 120. Anything higher, then I'm concerned. But the aim is to keep that number under control. If your fasting glucose is greater than 85 and you fasted for 6, 8, 12 hours, then now in my head, I'm thinking, wow, does this person have diabetes, insulin resistance? Okay. And now, along with the CMP, I am trying to keep an eye out on the electrolytes. So, your sodium, your potassium. And with your sodium, I like for that to be at the higher range, with the potassium being at the mid range. So, if we're experiencing headaches or cramps, we were always told to grab some mustard, rub mustard on your muscles, and sometimes it works. But honestly, try adding salt to your diet. And I know that that is like uh, what can I say? That's the bane of everyone's existence, right? They say, oh my gosh, keep away from salt. Salt is what's going to keep me swollen. But it depends on the type of salt, in the quality of the salt. What salt are you introducing? And we are going to have an episode that's specifically going to speak about salt. Within your CMP, I'm also looking at your protein levels. So you have 3 proteins. You have your total protein, your albumin, and the globulin. So your total protein, I'm hoping that number is above 7 because it helps with everything. When I think about protein, I want you all to think about how your body heals, right? How does your body function? Our body relies on protein for a lot. So when that number is above 7 and you're not getting any protein in, at least you have some protein stores that it can grab from. And then I think about albumin. I call that the fluid balancer. When our albumin is low, guess what? Our legs become swollen. Where do we get albumin from? Meat, particularly red meat, right? And then our globulin, which is another protein. Our globulin helps with hormone production and immunity. So when we're trying to build up our immunity status, we need to look at our globulin. All right. And where do we get globulin from? Again, our red meat. So increase your red meat intake. It doesn't mean eat red meat every minute of your day. It just means to increase it a bit. Okay. And now also look at your kidney levels. So those fun letters you see, BUN, GFR, creatinine, those are your kidney level function. Those are your kidney functions that we pay attention to. So for your BUN, I'm looking for that number to be on the lower end because the higher it is, it means that something's going on with your kidneys. Are you dehydrated? Right? Your creatinine also on the lower end of the scale, but your GFR, your glomerular filtration rate, should always be above 60. Lets us know how well your kidneys are functioning. Okay? And then lastly, your liver levels. I pay attention to your ALT, your AST, and your alkaline phosphatase. So I get a lot of people, especially my young people, when they come into the office, they're usually concerned about drinking alcohol too much. Is their liver affected? Okay. And honestly, no one can tell if you have any type of fatty liver disease from looking at your liver levels. You would need imaging to diagnose that as a gold standard. But what I'm going to tell you and look at is your ALT and your AST. And those numbers should be between 15 to 25. If it's lower, I'm suspecting malnutrition. And remember, it doesn't matter how much weight you have on you. You can still be malnourished because now it's all about the quality of the food that you're putting into your body, right? But if those numbers are higher than 25, I am suspecting liver stress and inflammation. The same with alkaline phosphatase. 50 to 60 is where I like for you all to be. But if anything is higher, I'm going to suspect liver stress and inflammation. So I'm going to ask you, are you on any other supplements? Remember, metabolism takes place in the liver. So I need to ask, are you on medication? What's affecting your liver right now? Right? But if it's lower, I am going to suspect malnutrition again. It's rare that I see a really low alkaline phosphatase, but it does happen. All right. And now going into our lipid panel. And guys, I do lab reviews just for fun. So I can kind of read this like off my head. I do these just for fun. So for your lipid panel, whenever you hear someone ask you about that or they're going to run it, they're trying to see what your cholesterol looks like. How is your heart taking it? Do you have metabolism or metabolic syndrome? Do you have insulin resistance? Do you have inflammation? So we look at your total cholesterol. I like for that number to be less than 200. Your triglycerides. This is why fasting is important because the triglycerides are very sensitive. So if you do eat a meal and you get your blood drawn, your triglycerides are going to be through the roof, 300, 400. And what you don't want is to be treated for a false level. So the goal is to fast for at least 6 to 8 hours, right? So for the triglycerides, I am looking for that number to be less than 99. If it is a little higher than 99, then yes, I am going to suspect insulin resistance or metabolic syndrome. All right. And we're going to have an episode on insulin resistance in November during Diabetes Month. How appropriate. Okay. And now your HDL and your LDL. We were always told that HDL is the good cholesterol and LDL is the bad cholesterol. Well, I got news for all of you. LDL has gotten a bad rap, because it really isn't bad cholesterol. LDL, when it's elevated, means that you have inflammation in your body. It's a trigger, it's a warning, it's letting us know that there is inflammation somewhere. And now we have, let's say, little marching men that's going to the scene of the crime in your body. And once too many men start to respond, and that is how you get a clot or get an occlusion, right? Because imagine a part of your body that has inflammation, and now you have these little lipoproteins going to figure out what's going on. Now you need so much to repair that now it's blocking the pathway. That is why LDL gets a bad rap, because now that it's blocking, it now could cause you to have a stroke, some sort of heart issue, heart attack. That is why LDL gets a bad rap. And we are going to have a cholesterol talk in the next few weeks. So I like for that number to be usually less than 100 as well. Now, the HDL, this is the number that we want to be higher. If I see you all in the 30s, I am concerned. Is it your diet? Are you not increasing your fat intake? And I mean good fats, avocados, avocado oil, coconut oil. Are you increasing your good fats? Because when that number is in the 30s, we are now triggering some sort of risk for a heart attack. So I like that number to be higher in the 60s and 70s. Okay. And that is your lipid panel. And then for your iron and TIBC and ferritin. All right. I have patients who deal with migraines, fatigue, brain fog, panic attacks, anxiety, muscle pain, muscle aches, joint pain, and they have no idea what's going on. And no one has ever drawn an iron level. Why? Because sometimes it's just not indicated to mainstream. So no one is going to draw that level. Okay? So, but here, I'm going to draw that level for you. So when I draw the iron in the TIBC, I'm looking for a couple of things. I'm looking at the iron saturation, iron level, your ferritin. Remember, your ferritin stores iron. We want that number at least greater than 80. For your iron level, I would love for that to be greater than 80. And then for iron saturation, optimal is 40%. When I get people in the office, they are usually so confused when they come in because they feel good, but that's their baseline because they've been living with their symptoms for so long that it's become normal to them. I get people whose iron saturation is a 4 and their ferritin is a 12 or 13. What does this mean to me and the patient? It means that you are severely iron deficient. And a lot of them say, hey, I'm either vegan or I stopped eating red meat, or I don't ingest any green leafy vegetables. They just don't. And that is a problem. Now, do I send these patients to get iron transfusions? There are some who need it. There are some who opt to take high quality Ferrochel, which is a supplement. Okay. So if you need these levels drawn, please get it drawn. If you're having those symptoms, that the migraines, the fatigue, the brain fog, the panic attacks, the anxiety, hair loss, if you're experiencing that, get your iron levels checked. And then make sure they get it checked, because sometimes we could abruptly, what can I say? We can abruptly hurt the feelings of our provider by requesting certain things. But remember, this is about you. This is about your health, right? So if you're feeling these symptoms and your doctor is telling you that you're normal, you're not. Don't even go for that. Don't accept it. That's all I'm saying. Don't accept it. Just ask for them to draw your iron levels. Okay. And don't be afraid to even start an iron supplement, but I'm not telling you to start an iron supplement by yourself, because remember that iron is still a heavy metal and there is a such thing called iron overload. So I know in my community, I know when I was growing up, if I thought I felt too cold, I would just start myself on iron. but that is not the right thing to do. Do not do that. Okay. Get your iron levels checked, because if that ferritin is sky high and you're supplementing yourself with iron, oh, you're going to be in big trouble. Because usually a higher ferritin, usually that means inflammation or something called hemochromatosis. And these are things that are serious. So don't just supplement yourself with iron. Make sure that your levels are safe first. Okay? Make sure it's safe. All right. And now let's get into our hemoglobin A1C. Hemoglobin A1C typically checks our average glucose for the past 3 months. So when people come in and they get this drawn, they say, okay, this is what I ate today. I'm not concerned with what you ate today. I'm concerned with how you were 90 to 100 days ago. That's what I'm concerned about. Okay. So if that number comes back higher than 5.6, according to LabCorp standards, then that means you have prediabetes. However, in my world, in the functional medicine world, I don't believe in prediabetes. It's either you have it or you don't. With mainstream medicine and what we're practicing here in the US, I feel like we use prediabetes as a term to make people feel good about themselves that they're not there yet. Honestly, you're there. If your number is 5.6 or 5.7, you are there. That means you have to do something about your diet immediately. I don't mean that you're going to die or anything like that. I'm just saying that number is really high, and it's starting something, because let's think about it. When we think about diabetes, we think about high cholesterol, we think about chronic kidney disease. Now think about your family or loved one, usually our grandparents, who had diabetes, high blood pressure, chronic kidney disease, they're on dialysis. All those play a big role in your health. Okay, so I don't believe in prediabetes. It's either you do or you don't. So we want that hemoglobin A1C to be below 5.5, but greater than 4.2. All right. And now here is a level that providers do not draw at all, and it is an insulin level. Mainstream medicine rarely ever checks this number, but why do I check it? I check it because insulin is a bully. So when that number is elevated, all of your hormones will be out of whack. I had one patient come in for weight loss, and this is why my weight loss program is different. I'm not just going to give you weight loss medication. That's just not what we're going to do. Not never, ever. So when I check your labs and I see that your insulin is greater than 7, okay, that's a problem. But my last patient came in and her insulin level was 122. 122. So now, is weight loss priority? No, it's not a priority anymore, because now we need to figure out what is going on. Okay. The thyroid also becomes out of whack. So if we're seeing that someone has hypothyroidism, which means an underactive thyroid, we need to now check the insulin levels. But here's one thing to remember. When elevated, it doesn't mean that you're diabetic. However, it opens the door to diabetes and other underlying conditions, such as kidney disease. So when I see people who have numbers greater than 7, I will tell you in my office, hey, you have mild insulin resistance, or you have insulin resistance, or you have metabolic syndrome. How can you fix it? Usually by diet, berberine. Okay. CM Core is one supplement that I do recommend for a lot of my patients who have metabolic syndrome. So when those have come in and they have insulin resistance, they hold a lot of visceral fat, that fat that's around the abdomen. Okay. So remember, insulin is a bully. It's a bully. Your hormones are going to be out of whack. So let's think about our men who have low testosterone. Think about our postmenopausal women or our perimenopausal women, all those hot flashes and night sweats and everything. How is your insulin level? All right, so just think about that. And vitamin D. Now this here, I don't know, it's like pulling teeth trying to get a provider to get you to get this drawn for you. I don't know why, but If you do go to the doctor and you know you've had low vitamin D levels in the past, please mention it to your doctor, because your doctor actually may order it for you, because now it's all about coding if you have insurance. Okay. So with vitamin D, we discussed this last week in last week's episode. For hair loss, plays a big role in everything. Plays a role in hormone production. It's great for immunity, right? When we experience low vitamin D levels, what happens? We feel depressed, fatigued, brain fog, muscle aches, hair loss, dry skin. What is optimal? 60 to 100. So earlier in this episode, I said my level was 4. I was way off. I felt like I was close to death. I don't know what that feels like, but if I had to put something in my head, that is what it felt like. Honestly, honestly. Okay. So we need to get our numbers up for my younger people and those who are on hormone replacement. Closer to 100 is ideal. I have one patient who came into the office on anxiety meds and antidepressants. Her vitamin D level was 5. In 4 months, she came back in. Her level was 100. And she looked great. She walked into the office. I couldn't even recognize her because she looked, I mean, it was like a complete 180. She looked different. She looked happier. She says, wow, I haven't had any migraines. I have all this energy. And look, and she was on antidepressants and anxiety medications. So imagine being treated for this, and your problem all along was a low vitamin D. So think on that, because that's huge. All right. And now let's discuss vitamin B12 and folate. Usually, this is a tough one. I rarely ever see this being checked at all. Um, if you're in a weight loss program, I usually see vitamin B12. When you're pregnant, I usually see folate. So everyone is different. Remember that. So a lot of my patients feel best when their vitamin B12 levels are between 800 and 1200. Just today, I had an even younger person come in today, and her vitamin B12 level was 290. So 290. And she has a couple of kids, and she thought that her fatigue was coming from her kids. No, it's coming from that low vitamin B12 level. Her folate or folic acid, that number was a 6, and that number should be greater than 7. So her diet is all the way off, and she needs supplementation. She needs it. Okay. And now let's discuss CRP, our inflammation markers, and uric acid. So that's a new one that I've been drawing lately. And I draw it on certain people. So if you come into the office and you're saying, hey, I have back pain, my stomach hurts all the time, things of that nature, your CRP, C reactive protein, that is an inflammation marker. That number should be less than 1. If it's greater than 1, there is something going on. Does it mean that it's coming from the joint pain? No, it just means that it manifested there. So it started somewhere, and that's where it's presenting. Does that make sense? So let's say you have underlying autoimmune disorder, and now you have muscle fatigue, muscle pain. So you see why it's important to get that level check. In uric acid, when we hear about uric acid, we always hear about gout. That's the only thing I always hear about, gout, gout, gout. But it's so much bigger than gout. Gout, or uric acid, excuse me, is another inflammation marker. So we want that number to be less than 7 or less than 6. When that number is higher, I don't always suspect gout. I now suspect inflammation. What else is going on throughout your body? What's going on, right? This is why deep dives are super important, especially when you're going through things. Okay? So that's super important. So CRP, uric acid. Okay? Now let's get into one of my favorites, the thyroid panel. So earlier I mentioned that TSH and free T4, well, TSH is usually the only one that they draw. Free T4 is a sometimes. But I know you've never had a free T3, a TPO, a thyroglobulin antibody, or a reverse T3. I'm 1,000% sure that you haven't had that done. Maybe you've gotten it done at an endocrinologist's office, maybe, and that's a big maybe. But usually it's just a TSH. And if they see that your TSH is within normal limits, remember, we don't like that word tonight. Normal is not it. We're not normal, right? So when they see that it's within normal limits, that is it. However, you are still experiencing metabolism issues. You can't lose weight even though you tried everything. Your hair is falling out, your skin is dry, you feel down, you feel depressed, the brain fog, fatigue. You have a lot going on. So if you have a lot going on, why not check the rest of your levels? So with me, I'm going to check your free T4 and your free T3. Most likely, I'm going to find something. So just today, I have a patient whose TSH is 9.8. Where do I like to see it? Less than 2, preferably less than 1.5. Their level is a 9. Free T4 was normal, but their free T3, or excuse me, not normal, free T4 was within optimal limits. It's like 1.06. Free T3 was 1.9. Where should it be? In the upper range, so closer to 4.5. This person feels horrible. But in their head, they're thinking that they just need hormones when really it's their thyroid that's out of whack. And so, because of that, I went ahead and drew a TPO level and a thyroglobulin. Why? Because now I need to make sure that they do not have underlying autoimmune disorders such as Hashimoto's. Hashimoto's thyroiditis. We're going to have another episode. Autoimmune order. What does that mean? Thyroid. The thyroid is trying to live peacefully, and it can't because the body keeps attacking it. Okay. So what does that mean? That means that you will now have to be appropriately managed. But this may have never been found if only a TSH level was drawn. So you see how crazy that is? You're still having symptoms, but none of these levels are being drawn. What's shocking to me is that you could have an autoimmune disorder. And remember, when you open the door up to one autoimmune disorder, it opens up the door to all autoimmune disorders. Okay? So that means fibromyalgia, lupus, right? IBS, all that stuff. So it is going to be super, super, super important for you to get these levels drawn. Your life depends on it. You deserve it. And you deserve it. There's no other way around it. You deserve it. Okay? Any questions? Because I can go on and on about some thyroid. Now, let me go back to something real quick. Reverse T3. When I do give my patients who are on Synthroid, they always look at me like I have 3 heads. Because I always want to make sure, I said, should you be on Synthroid? Should you be on levothyroxine? That reverse T3 is going to let me know if they should not be on it. I've had a few patients already who I've said, no, you shouldn't be on that. And why not? Let's talk about that. Why not? The thyroid has 4 hormones. So when you're only taking levothyroxine, you're only taking T4. What happened to T1, T2, T3, and T4? What happened to that? So we're only supplementing with T4. What happens to T3? And if you recall, I said that if someone's free T3 is low, oh, they're going to need something. And most likely medication. Most likely medication, not supplements. Now, what I'm not saying is that everyone who has abnormal thyroid levels, such as a lower T4, or excuse me, T3, free T3, and an optimal TSH, not everyone will need to be prescribed thyroid medication. Now we need to look at the bigger picture. How is the vitamin D? How is the iron? How is the B12? How is the insulin? Remember, insulin is a bully. If you don't get anything else tonight, know that insulin is a bully and that you're not normal, right? So if those numbers are way out of whack, then I would expect your free T3 to also be out of whack. But if you are on T4 already, we're going to check that reverse T3. We're going to check the reverse T3, because if that level is greater than 18, we need to change your medication. That means you're on the wrong medication. I have a 90-year-old who's been on Synthroid forever, and she has been written off as having Alzheimer's or dementia. When I checked her reverse T3, it was completely out of whack. When I checked her free T3, that number was 1.3. So when she went to her doctor at the time, they said, "Oh, she has Alzheimer's dementia. She's already been diagnosed for it. It's already in her chart, in her medical record." I changed her thyroid medication, and guess what? She's alert and oriented ×4, meaning that she knows her name, her date of birth, she knows where she is, she knows the situation, she knows events. And all this time, it was because her thyroid was out of whack. So you see how important it is to get these numbers drawn, get these levels drawn. It's important, okay? You will get a lot of pushback from your doctors. That's just a known fact. You will. And that's okay. Because guess what? We're in 2023 now. So we have places like walk-in labs or Ulta Labs where you can purchase your own labs with cash. But here's the downside to that. You're going to need somebody to read it. Okay? So I know I do offer lab interpretation reviews because I think it's important. It's no longer acceptable to accept that. Ooh. Okay? So it's no longer acceptable to accept being low or being abnormal, but being told that you're normal, you know? Everyone is different, and that's fine. All right? So this is when your labs do not tell the whole story. So again, we're going to go over the labs that I draw, because maybe you should write it down, because maybe your provider will be able to run these labs for you. All right? So we're going to go through it one more time just so you have it. I draw a CBC, a CMP, a lipid panel, a hemoglobin A1C, a fasting insulin, an iron panel with ferritin, a vitamin D as in David, a vitamin B12 and folate, a TSH and a free T4 with the free T3. You should have the TPO and thyroglobulin antibodies at least drawn once a year. A reverse T3 whenever you're on levothyroxine or Synthroid. FSH and LH for women who are not on birth control. Okay, and the CRP level. And again, if you are experiencing metabolism issues, you can't lose weight, there's something wrong, that's when I draw the hormone panel: testosterone, estradiol, progesterone, DHEA. And for my men, I add in prostate-specific antigen, also known as the PSA. And for those who have absorption issues, I will order a homocysteine level. That will let me know if somebody has an MTHFR mutation. So that's usually if you are taking vitamin B12 supplements and it's not going anywhere. It's remaining to be high. Remember, B12 is a water soluble, so it shouldn't be high all the time. Usually when you stop your B12, your B12 prior to your labs, usually it drops. If it doesn't, then there's something wrong, especially if you haven't had B12 in a long time. Okay. So again, everyone is very specific, but I draw those because I get a lot of surprise diagnoses. All right. Oh, we have a comment here. I have a goiter in my throat. Sometimes it's difficult to swallow, but my doctor said I am fine, but I don't feel like it. And you have the symptoms. So if you have a goiter, we need to check. Do you have hyperthyroidism? Do you have hypothyroidism? What's going on? Okay. A lot of patients are in your boat where people get thyroidectomies, where they have their thyroid removed, or they have thyroid radiation. And the thing is this, when you get all those procedures done, you really do have to be placed on thyroid medication afterwards. Do not let a doctor tell you otherwise. I have a 70-year-old patient now who actually went through a clinical trial in the 80s where they radiated their thyroids and just tried to see how they would survive. Now, I don't know who signed up for that. I'm not sure if there was compensation, but I know now thyroid is, well, she doesn't have it. Her thyroid is it's bad. It's radiated. Okay. Thyroid is radiated, so now she needs thyroid medication. And then guess what? This is my chronic pain patient. Chronic pain. Since starting her in June, she has not had any exacerbations with her pain. But again, Miss Arnetta Marie, if you really do feel like you have those symptoms, you really do have to find a qualified provider who will listen to you. That's all you need. Those are the key words, who will listen to you and draw these labs for you. It's super important. You deserve it. That's your health. It's difficult to swallow. I'm sure your quality of life is down because you don't know what's going to come next. And you're probably not how you used to be. Okay. Have another question. Can you manage my thyroid disease if I cannot come into your office? I absolutely can. Okay. Telemedicine. So I service the Maryland area, Washington, D.C., Washington State, New Mexico, and Colorado. If you can't come into the office, telemedicine it is. And with the medication that we give people, it's high quality. So it's usually from a compounding pharmacy where there aren't any additives in it, like cornstarch, which will contribute to inflammation. Okay. So it's important. I think this is an important conversation. Um, Health tea isn't always about, gossip or anything. This is real tea about our lives. Okay. That was the purpose of this channel, just so that you can understand how to advocate for yourself. You're not crazy. You're not. It's your body. It's your body. That's the key word. That's the T. It's your body. And so here's a tricky question. What if my doctor doesn't agree with your treatment plan? Can I still see both of you? This is a very important question. So I have to breathe on that one, because when people come to see me, it's for a reason. You're coming to me because you have been failed by mainstream, right? So when you come to me, as much as I would love to say I will collaborate with your PCP or your other doctors, that does not work. That partnership doesn't work because our trainings are different. So at any moment, if you think that the treatment plan doesn't work because your doctor doesn't agree, then guess what? We will peacefully part ways and you can continue to be under the care of your doctor, because at the end of the day, I do promote advocacy. You advocate for your health. But when you guys come to see me, it's because you need the help. Trust me, I will not steer you all wrong at all. Not at all. Okay? Especially with the questions tonight. If you are feeling a certain kind of way, then this should have been fate for you. This listening to this. Hopefully you guys understood everything. If you have any more questions, please absolutely let me know. Okay? Because this is important. I love doing this. I can do this all day, every day. All right. So if you wanted to have a consultation with me, it's free 15 minute. I want you all to visit bit.ly/health tea with Dr. B. I have it below. I'm getting fancy, you guys. I know how to do this stuff now. I'm no longer a grandma to technology. So visit the link below. Okay. But honestly, this has been a pleasure. You all have been great. Please follow Health Tea with Dr. B, the NP, on Facebook and on Instagram, okay? Because I have a lot of things going on there, all right? I have a lot of things. But with bit.ly/Health Tea with Dr. B, you will learn how to become a patient of True Phoenix, get a free 15-minute consultation with myself. Okay, and remember, if you are not listed or in the states that I mentioned earlier, Maryland, Washington, D.C., Colorado, New Mexico, Washington State, I can refer you to other people in different states, such as Virginia, Delaware, Texas. Just let me know. Okay, just let me know, honestly. All right. It seems like you spend a lot of time. Oh, another question. It seems like you spend a lot of time with your patients. That doesn't seem to be the norm for regular doctors' offices. It's not the norm, especially now. Especially now. Okay. So I spend a lot of time. I go through labs with a fine-tooth comb. Okay. So when you all see the highlighters come out, know that it's about to be on with those labs. I love it. I absolutely do. And unfortunately, a lot of patients or a lot of doctors have a lot of patients. They see maybe 6 patients an hour. They don't have time to really go down that line for you and with you. They don't have the time. They don't. And it's okay. But guess what? Because you know where to go to get the help that you need and deserve. Right? That is the biggest take of it, because the goal isn't to put tea on anybody. The goal is just to make sure that you are being your best self because you are advocating for yourself. So this is free information. Do what you want with it. If you need any more help, follow Health Tea with Dr. B, the NP, on Facebook and Instagram. All right. We go live every Wednesday. Every Wednesday. All right. This is our fourth episode. This has been awesome. You guys have been absolutely amazing. Thank you all in the chat who responded and participated. Thanks. I have 2 Arnettas. Both Arnettas. Jasmine, thank you all. Thanks to Jessica, Tom, let's see, and Lily on my Restream here in the live stream chat. Thank you all for joining. I will see you all next week. Remember, if you have any other questions for me, visit bit.ly/Health Tea with Dr. B. Set up a free 15-minute consultation. I'll be more than happy to speak to any one of you. All right, guys, enjoy the rest of your evening. Take care now.